When John Walker saw the little girl's fingers, he immediately felt something was wrong. He quickly put the bucket down, snatched the ice candy from the small boy's hand, and without hesitation, ate it. He then took the wooden stick of the ice candy and fixed it onto the girl's severed toe. After that, he swiftly removed the ribbon from the girl's hair and, in a few seconds, applied a makeshift splint. Just then, the girl's father rushed in, flustered. John specifically advised him to take her to the hospital immediately. As expected, the doctor was astonished when he saw the splint. He couldn't believe it was exactly the same as described in the medical books. The doctor said that if they had waited any longer, the toe would have been permanently damaged. He then arranged for a CT scan. However, in the hospital corridor, the girl suddenly heard a very familiar voice. When she looked closely, it was the same John Walker who had fixed her toe. Just as the girl's father was about to approach him, he suddenly began coughing violently. John immediately placed his hand on the man's chest, but the father pushed him away. However, within moments, the father started having trouble breathing, and his face turned pale. The hospital was crowded with patients, and no doctor or nurse noticed. The girl screamed and begged for help, but no one responded. In that moment, John Walker remained calm. A female doctor heard the girl's cries and wanted to check, but a patient called her away. With no other option, she sent a colleague to check on the girl's father. John Walker felt the situation was serious, so he followed. Just as they entered the elevator, the girl's father suddenly collapsed and fainted. John Walker rushed into the elevator, but a doctor pulled him out. In critical condition, the doctor laid the patient down and rushed to bring medical equipment. During this time, John Walker placed his hand on the man's chest. He felt as if he were witnessing the moment of the heart stopping. The doctors arrived and began setting up the necessary equipment for resuscitation. But John told them it was too late. The man's heart had already stopped. The doctors ignored him and continued their efforts. He then took the equipment away and stopped the resuscitation. The doctors checked again and realized the severity of the situation. Everyone immediately started CPR. A nurse brought the defibrillator. John Walker joined the doctors in the rescue efforts. Fortunately, after all the efforts, the heart started beating again. But immediate surgery was now critical, and there could be no delay. The surgery room was ready, but the lead surgeon was nowhere to be found. All the surgeons were busy saving other patients. A nurse, worried, said that if they waited any longer, the patient wouldn't survive. The girl stood to one side, crying. She knew that John Walker was the only one who could save her father. She pleaded with her eyes for his help. But if he operated now, without a medical degree, it would ruin his entire future. He hesitated for a moment and then turned away. But the girl suddenly grabbed his hand and secretly placed a coin in his palm. She was looking at him with tear-filled eyes. Finally, John Walker made up his mind. No matter the consequences, he would save her father with all his strength.